Hi everyone, I welcome you all to the Breastfeeding Week Conclave by VOH, powered by MCure. And today I have with me Dr. Rishma Pai, who is an honorary consultant gynecologist at Lilavati, Jaslok, and Hinduja hospitals, Mumbai. She is the only Indian to have served as a president of all four leading gynecological, infertility, and endoscopic organizations, which are FOGSI, ISAR, IAGE, and MOGS. She has also received various international and national recognitions and awards for her contribution towards healthcare. And I am Dr. Mahima Bakshi, a woman and child wellness consultant and founder of Birthing Naturally Queen. I welcome Dr. Pai to the chat.
Thank you. Good afternoon to all of you, and happy Breastfeeding Week to all of you.
Thank you so much for joining for this live chat, ma'am. It's a pleasure to see you. So since it's World Breastfeeding Week going on, we will be discussing about the correlation of breastfeeding along with the entire COVID pandemic that has been going on. So please tell us about what you think, according to you, is the consequences of COVID infection during pregnancy on the woman.
So it's something which all of us have been faced with since the last year and a half. Lots of women, unfortunately, during their pregnancy have been getting COVID infection. In the first wave, we saw that most of the women did very well. They behaved almost like, they were not suffering from COVID. But in the second wave, I think it was a lot more severe. We lost many mothers to COVID because of severe infection. And obviously, if we lose a mother in childbirth, then the baby is going to really suffer the consequences. So it's been a very hard time, and we have learned many lessons about this new disease. And I think today we are much better prepared to take on infections of COVID in pregnancy, during lactation, and all these very vulnerable phases.
Right. And now that the vaccine has been introduced, how safe is it for women in pregnancy or during lactation to take the vaccine?
In fact, our federation, FOGSI, really sort of strongly recommended lactation and pregnancy to be allowed to take the COVID vaccine. And fortunately, the government has just a few weeks ago approved that. Now, there's only one slight worry, and that is the vaccines that we have in India haven't been really tested or tried on pregnant women. They seem to be very safe. They are not live vaccines, and we give many vaccinations to pregnant women, during their pregnancy and lactation. So it appears to be a fairly safe vaccine. Most of the studies, and there are like more than 1 lakh of pregnant women who have been studied in the USA with mRNA vaccines, and that seems to be very safe. And there's no reason to believe that our Indian vaccines are different. So definitely, now that the government has recommended it in pregnancy and during breastfeeding, go ahead and take your 2 doses of the vaccine. And it doesn't matter which phase of pregnancy you are in. Normally, we tend to avoid the first 3 months of pregnancy because that's the time when the child is really developing. But any phase of pregnancy, or even if you're planning pregnancy, for example, you can go ahead and take the vaccine safely.
Super. And if a lactating woman takes the vaccine, so does it affect her breastfeeding at all, or she can absolutely continue breastfeeding as it is?
Yeah, so actually the vaccine is found to have no impact on breastfeeding at all. In fact, there may be a positive to it, as in the antibodies which the mother produces will probably go through the breast milk and give some degree of immunity to the baby, because we know that young children are not being given the vaccine right now. So the baby might get good sort of natural immunity from COVID through the breast milk. And the vaccine, since they're not live vaccines, it's unlikely that anything will transmit to the baby which is dangerous. So vaccines are pretty safe in lactation. Yeah.
Amazing. So if you know a pregnant woman or a lactating woman, encourage her to go take the vaccine. And all of you, the other people in the house also, everyone should go and get vaccinated.
True.
So ma'am, since there are a lot of stories going on also about that there are different kind of variants being found, about COVID, and now there's a third wave anticipated in India. Is there any particular kind of a variant that could be more threatening to a pregnant woman or a lactating woman?
There is no such belief at all, because all viruses mutate. Every single virus, whether it's just influenza or what the vaccines we had and the infections we had in the past, all of them tend to mutate, and there is no reason to believe that they will be more severe. In fact, we hope and anticipate that the next waves will be milder, because a lot of people are now vaccinated. Some of them have got antibodies due to exposure to infection. So we hope that as the community gets vaccinated, we hope that in fact each subsequent wave, if there are any, will be much milder, and we'll be able to face them much better and more safely. Yeah.
Very nice. So then people don't need to worry too much about it or not stress out too much about it.
It's all about taking precautions. I think the good thing that has happened is
Great.
now, in a very short period of time, we have a
Great.
lot of information. And so
Then,
because of the information, we can protect ourselves a lot better. Sorry, I couldn't hear you,
right.
Mahima. I didn't hear you. Yeah.
So if we practices in India, yes, can you hear me, ma'am?
Now I can, yes.
Yeah. So if we talk about the breastfeeding practices seen in India,
Yeah.
yes. So most of the families, how aware do you think they are regarding the correct breastfeeding practices?
Breastfeeding is a very natural phenomena, but it really requires, I would say, teaching and information and support. So I often tell my patients jokingly, the pregnancy part was very easy. Now that's over. The hard part begins now, which is the breastfeeding, which you have to do for many months after delivery. Because, even though it's natural, the correct way of latching on, the correct positioning, the quantity of breast milk, whether the baby is getting enough or not, and then there are sometimes, because of improper practices, there are cuts on the nipple, there is breast abscesses. So it's not that easy. It requires a lot of support, psychological support, counseling, and encouragement, and also actually teaching or training in certain cases. So though it's natural, it requires a lot of support, I feel, for very successful breastfeeding. A lot of encouragement. Yeah.
Yes. Yes.
I think we have a
I
bit
think
of an
very
issue.
well said that to ensure.
Yeah.
Yes. Can you hear me now?
Yes, I can.
Yeah. Yes. So I think ma'am very well said that to ensure successful breastfeeding is important that one needs to understand the techniques and learn the
Yeah,
art of breastfeeding. I think it's
absolutely.
an art. Yes. So if we talk about the theme of this year, which is protect breastfeeding, a shared responsibility. So how do you think as a community we can ensure that we protect breastfeeding, and how can we encourage the family members to share the responsibility equally?
Yeah. No, it's really, we have to protect breastfeeding because it's a win-win situation for all. For the baby, all of us know that, of course, it provides almost complete nutrition, which the baby requires up until a period of 2 years of life. In the first 6 months, it gives complete nutrition. Second 6 months, half the nutrition that the baby requires. And in the second year, 1/3 of the nutrition that the baby requires. So it's wonderful for baby nutritionally. It also improves, the cognitive, the sensory functions of the baby, prevents infections in the baby like diarrhea, pneumonia, long-term chronic diseases. So it's very beneficial for the baby. That is understood. Not only for the baby, even for the mother. It actually reduces breast cancers, ovarian cancers, helps the mother sort of get back into shape after her delivery. And of course, so being such a positive act, the act of breastfeeding, it really requires the support. And like I said, the mothers are often going through a very difficult time post-delivery. There's postpartum depression sometimes, there's fatigue, there's weakness, she's not confident, especially if it's the first baby. So there's a lot of support which is required, and the doctor cannot be there all the time with the patient. So we do fortunately now have lactation consultants, We have, older people in the house who are more experienced who can help. And of course, mainly the support of the husband, who will say that, I can't actively help you, but I'm there with you to support you, to, sort of give you encouragement. So it's really a community which will support breastfeeding. And I've seen this very often. If some people from the family, the relatives, the mother-in-laws, they keep on sort of blaming the lady, oh, you don't have enough breast milk, the baby's crying all the time, oh, it's your fault, you're not doing properly, you're not feeding properly. So the mother, who's already so vulnerable, gets very, very shaky and, lacks confidence in breastfeeding, and that impacts the breastfeeding. So we need support from the entire family for successful breastfeeding.
Rightly said. So if we talk about the role of family, and I would like to split it up into two parts. One, the role of the husband, and one, the role of the mother-in-law. So a lot of science has also changed over the years, but a lot of times, mother-in-laws want to kind of pass on the information which they have learned during their times.
Yes.
So how do you think is the best way to tackle that situation?
Yeah. It is actually very complex, because in India, a lot of people live with their extended families, and there are literally 5 different inputs coming in every day about what they should eat, what they should drink, how they should feed, how many times they should feed. So, the poor lady gets very, very confused, and she doesn't want to disrespect anybody. At the same time, she's totally losing confidence. So I literally tell my patients that, any advice, please take it from either from the gynecologist, that is me, or from a lactation consultant. Rest, listen to everybody, say yes to everybody, but please do exactly what is scientifically told to you. Because, there are a lot of myths, which earlier they used to say that the first milk, the colostrum, the first milk which comes out, which is yellowish in color, scanty, should not be given. And in fact, that's completely wrong, right? Colostrum is what we actually call liquid gold. It's full of antibodies, it's full of nutrients, and you should always give the first milk. So discarding the first milk was a myth and a very bad practice, and we discourage it. But, the older ladies may still follow that. And then the kind of food that they have to eat, and avoid this kind of food. And, so, something which is natural and doesn't harm, we don't mind. But, it's not sort of scientific. I think we have to discourage that. So there has to be, good scientific information. Take the advice, but at the end of the day, the couple has to decide what they want to really follow.
Very well said. So I think it is good to take advice from people, but then ultimately do what your doctors are telling you to do.
Yeah, because there are 10 different pieces of advice which are contradictory. Yeah.
Gets too confusing then, yes.
Yeah.
And now if we talk about the second half, which is the role of the partner. Now, again, when we see a lot of mother-in-laws thinking that, no, it's okay, I am there to support the daughter-in-law, my son doesn't have to be involved. But we encourage gender equality, and we want the husbands to participate in the whole breastfeeding process. So how can husbands share more responsibility towards supporting breastfeeding for the new mother?
In fact, I think times are really changing. I've been in practice now 30 years. And in the early part of my practice, a lot of the patients, even when they came for their antenatal visits, were accompanied more by the mother or the mother-in-law, rarely the husband. Now it's almost, I would say 90% and more, the husband who is there. He's very concerned. Even yesterday, I had a husband with his diary, writing down, the notes and asking questions. So more husbands are now involved. And I think at the end of the day, it is the husband who's going to be there 24/7 and should be there. It's as much your baby as it is the wife's. And in fact, I think the husband is should be more involved during breastfeeding, because they can't actively do anything. They can't actually breastfeed. So the least they can do is be there and support and help in any which way, at least, with the other part of the caring of the baby, the cleaning up the baby, the changing the baby, burping the baby, all that should be done by the father, because you have to have a role to play. And once in a while, if the mother is really exhausted, for example, I would say that, she can express or feed for the night, and she can sleep few hours, and the husband can give that expressed breast milk to the baby, one feed in the night, so that the mother gets some rest. So, I think it's really, really important. The husband can make sure the wife is taking her nutrients, her vitamins, her iron, her calcium, DHA, whatever is being given to her, so that, he feels involved and is part of the process, which I think is very important for bonding and, for subsequent the love and the relationship they'll develop with their child.
Yes, truly said. And now I actually contemplate and think about it retrospectively that when COVID was hitting us badly, and there were women who were catching COVID, they were testing positive during those 14 days of isolation, how difficult it must have been for these little babies to, stay without the mother.
Yeah, but now, Mahima, the recommendation, almost all organizations, World Health Organization, almost everybody is saying that even if the mother has COVID, active, like she's infected right now, she can continue to breastfeed her baby with all precautions, of course. So that education is very important. She has to be masked all the time. She has to wash her hands very frequently. All surfaces need to be cleaned. If at all they are using, for example, a katori chammach or a bottle to feed the baby expressed breast milk, that should be cleaned very, very well. So once precautions are in place, there is actually no need to isolate the baby from the mother. And please note, the baby cannot be masked. You cannot put any cover on the baby's nose or face to prevent baby from getting infection. The mother has to protect herself. The father has to protect himself and be masked and wash hands and surfaces, cleaning, all that has to be done. So very rarely, if the mother is very sick, if she's really serious, for example, she's in the ICU, or if the child is unwell, born prematurely, which is common in COVID, premature deliveries, then the baby may be in the neonatal ICU. Then those situations are different. And there too, we encourage, if possible, the mother to express the breast milk and to give it in a bottle or in a boiled steel katori to the baby. So the baby gets the benefit of the breast milk without, even though baby is not being breastfed at that point. And as soon as mother's well, directly she should take the baby onto the breast. So practices are changing. In the beginning, we were very scared and we didn't know. But now there's more confidence. Yeah, now there's more confidence.
Yes. Yes, so that's good. At least now everyone is more aware of what the right kind of practice is in case a third wave hits.
Yeah.
Yeah, great. And ma'am, if we talk about public breastfeeding in India, which is a subject very close to my heart as well. So how do you think we can sensitize men, which is a task in India, I understand. But according to you, how do you think we can sensitize the men in the society so that public breastfeeding becomes more normalized in India?
I mean, it's the most natural thing in the world. And every man, or almost all men, have been breastfed by their mothers, right? If you look into it that way, so if you underline that, say all men respect their mothers. So if you say that you were breastfed by your mother, if your wife, if you're married, or your future wife will be breastfeeding your children, your sister is breastfeeding her baby. So, I mean, what is so unnatural about it is perfectly natural. It's a beautiful act. It's an act of love and warmth and affection and nothing else. And in fact, many countries of the world now, you can see there's no stigma attached to breastfeeding in public. I remember when we were in Australia, my husband was studying there, and in the classroom, in the university, the professor used to come with her baby strapped on in a little hammock, and when the baby would cry or would need breast milk, she would just turn around in front of the classroom, just turn around and feed her baby, and it wasn't considered abnormal at all. Fortunately, even in India now, most of the offices, big sort of institutions are incorporating breastfeeding friendly practices. They're having a room where you can breastfeed. They're encouraging the mother to, take the time off. So I think there's a lot of positivity about it, and spreading awareness through programs such as this, through visual media. There's so much now. Spreading awareness, fortunately, has become easy with social media. So instead of using social media only for stupid content all the time, at least part of social media we should use for very important practices such as these. Encourage breastfeeding. The mother may not be able to go home for breastfeeding, so wherever she is at work, out for some chores, let her breastfeed her baby. Then you don't want the baby to starve just because there are people in the public space and the mother cannot feed. So I think it's all about awareness and creating the right atmosphere for breastfeeding, wherever the mother may be.
Very well said. So I think on that note, I would like to tell the audience that please ensure if you have a pregnant woman or a new mother in the house, support her, encourage her, and let her give her best which is the breast milk to the little one, because that is what we want. With you and all the information that you share today with the viewers. I'm sure all of them are going to gain lots and lots of knowledge through this.
Thank you. I just want to end by saying that breast milk is warmth and love and nutrition all rolled into one. And so the mother and her entire support team has to be encouraged and, really sort of given positive reinforcements to go ahead and breastfeed the baby.
Well said. Thank you so much, Dr. Pai, ma'am, for joining for today's live chat. It was a pleasure chatting with you.
Thank you. Thank you so much. Pleasure's all mine. Thank you.
Thank you. I would also like to thank MCure for sponsoring this show, this Breastfeeding Week Conclave, and VOH for giving us this opportunity to spread awareness through this platform.
Thank you.
Thank you, everyone. Have a great day.